Hi, I'm Sylvia Gordon, the Medicare Mama, here to do my least favorite thing in the whole world, which is math. Let's do the math on a late Part D, a drug plan penalty. A lot of people turn 65, they should enroll into a drug plan, but they're really healthy. They're not taking any medication, so they don't. They didn't look into it. They didn't know there was a late penalty. Then later down the road, they call us at the Medicare Family because something happened. They got sick and they need some expensive drugs. Can we get them enrolled? Sure. You still have the right to enroll if you worked at least 10 years and paid your Medicare payroll taxes. But you might have to wait certain timelines. You can't just enroll any old time you need it. So we might have to make you wait a little bit. Waiting is the problem. If you waited past your initial enrollment period when you were first supposed to, which that can vary for people. You might still be working at 65. It can vary. But the majority of people enroll at 65. So you, in my example, I'm going to call you Bob. You didn't enroll at 65, and now it's a year later. And you're like, okay, get me in the plan right now. And for 2025, the penalty is calculated always the same, but it's based off the annual base premium for that year. The government just announced it for 2025. It's going to be $36.78. So that's the average price. Doesn't mean that's the plan that you're going to buy. You might buy a plan that's $20, but the penalty is based on this average plan the government gives us. So you take the number of months that you didn't have Part D, that you were eligible to have Part D. Let's say that's a year. So it's 1% times the penalty times every month that you were out. So you were out a year, 12 times the $36.78, and you come up with something like $4.50. It's close. So they round it to the nearest 10 cents, and you will pay that every month for the rest of your life. It doesn't expire. A lot of people think, well, it expires at 70 or surely it expires at 8. No, it doesn't ever expire. Now you can appeal it if you think you got it in error, that you had credible drug coverage. There are reasons why you didn't have to enroll. You can appeal the late Part D penalty. You can Google this form, C2C, C2C, and you can appeal it. Most people aren't going to win on appeal. You're going to have to pay this penalty for the rest of your life. Now, if you do have low income and you end up getting a government subsidy, they would take away your late penalties. But the majority of us, if you get hit with a penalty, you'll be paying it every year. So every year, it is going to go up. Last year, the base annual premium cost for Part D in the nation was $2 less. And the year before that, you see what I'm saying? So if it keeps going up, which it will, your penalty will keep going up. Done. This is why it's critical if you're out there watching this because you're getting ready for retirement and you're not yet in this situation, that you avoid this situation. They're not just late Part D drug penalties, but they're much, much stiffer late Part B penalties as well. And most people end up paying both penalties every month for the rest of their life. So I love it when people are watching my videos that are trying to help their parents. They're younger, because a lot of people, this is very hard to navigate. And that is what our family's doing. We've been doing it for over 45 years. We've helped tens of thousands of people with their Medicare decisions. Our services are completely free. If you need some help on this, or you need to enroll in Medicare Part D soon, book a free appointment on our website, themedicarefamily.com. We're licensed in all 50 states. We'd love to help you navigate this crazy thing called Medicare. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.